The patient is seen with cardiac left anterior descending artery stenosis and atheromatous plaques within the walls of coronary arteries which block blood flow. Put the sheath into the radial artery, followed by sheath-eluting stent to restore the blood flow. After a radial artery puncture operation, the tourniquet is applied for hemostasis by pressing on the puncture spot. Note: during the process of hemostasis, the bleeding spot should be clearly observed. The patient's wrist should be kept straight and avoid excessive upper limb motion. Apply tourniquet to the sheath. The front end of the pad aligns with the skin puncture point, while the central part of the pad should be directly on the bleeding point of the radial artery. Attach the Velcro band around the wrist and fix the Velcro band firmly. When the green pressure indicator is leveled with the turn cap, it is attached in position by the Velcro band. Rotate the pressure cap in the direction indicated by the arrow. Tighten the cap clockwise by 3 to 5 full circles. The green pressure zone, which is 100 to 200 millimeters of mercury, represents the pressure-safe area. If the indicator is over the midline of the green zone, the pressure shows approximately 150 millimeters of mercury. Keep rotating to the yellow zone, 200 to 250 millimeters of mercury. It suggests excessive pressure. Then the device will lock up for protection from tissue damage. Note: the choice of hemostatic pressure depends on each individual's condition. Complete the operation and check the bleeding status. Confirm that the radial artery and ulnar artery pulses to avoid tissue ischemic necrosis. Check procedures are as follows. 1. If you press the patient's thumb or index finger, and the pressed area is filled with blood, it will mean the radial artery runs well. 2. The thumb arterial pulse can be felt. When removing the sheath, compress both ends of wrist plates to yield a small space, allowing the sheath to be pulled out without damaging the tissues. The pressure should be referred to the position of the green pressure indicator. Note: during extraction, the pressure provided by the tourniquet should be maintained until there is no bleeding from the puncture spot. The pressure indicator should not exceed the top yellow zone. If the band is loose, it can't attain adequate hemostasis pressure. However, if the band is too tight, continuous compression will cause numbness or pain. Pull the sheath out. Release the wrist plate ends swiftly to avoid unexpected bleeding. Examine the bleeding on the puncture site immediately. The duration of compression depends on catheter diameter or types, surgery duration, and doses of anticoagulants. Usually 6 to 8 hours is enough. It is normally recommended to decrease pressure every 45 minutes to an hour. Procedure: rotate the turn cap. Gradually decrease the pressure. Rotate the turn cap counterclockwise by 1/2 to 1 full circle. Theoretically, rotation of 1 full circle will decrease pressure by 25 millimeters of mercury. Note: the pressure should be adjusted according to the hemostatic status and the patient's condition. When hemostasis is completed, rotate the turn cap counterclockwise. Remove the tourniquet. Confirm that there is no bleeding on the puncture site and dress the wound. Note: avoid upper limb motion for 2 hours after operation. Constrain motion of the wrist joint for 4 to 6 hours.